no cases of COVID-19 in either in any residents or staff. Many of you will know that on Friday, December the 11th, an outbreak was declared at Lee Manor. The definition of an outbreak is a single confirmed positive case of COVID-19 in either a resident or a staff member. In this particular case, it is a staff member. Over the period of time that public health is focused on investigative tracing, the staff member worked only one shift, and that was on 2 North. The staff member did all of the right things. They worked their shift. The next day, they began to have symptoms. They went immediately to be tested. They contacted the home, and we're very grateful that they followed the steps required in order to allow us to have a very quick response. The outbreak has been managed by and directed by public health, and the team at the home has been doing an amazing job. All residents, staff, and DCPs linked with 2 North were tested on Friday. That's 123 tests. 119 tests have already come back negative. We're still waiting for the final 4 results, and we will keep you posted. Residents and staff we are all very encouraged by these updates, and spirits have been lifted. Everyone has been running through IPAC strategies for refreshers, so practicing donning and doffing PPE, the steps required for meal delivery and service on 2 North. So all of the residents on 2 North are isolating in their rooms, and so they are having their meals in their room. And each resident is on droplet and contact precautions. And so the teams have been practicing how to don and doff and be sure that we're using those strategies correctly. DCPs are limited to 1 person throughout the building per resident, and general visits are suspended. All of these measures will be in place for the duration of the outbreak. Once all of the test results are back, and even when they're all negative, but we're still waiting, the outbreak measures will be in place for the full 14 days from the staff member's last shift. So that takes us to December 21st. I knew that people would be really looking for an update, and so I wanted to get that information shared out at the beginning of the call. The other things that we're going to talk about during this call is updated Directive Number 3, which was released on December 7th. Confirm that we will be continuing to suspend outings and day trips, and we'll talk about that a little bit more. Give you an update on the resident and family satisfaction survey. We can do a little cheer about the vaccine, and then answer any questions that anyone might have. So as you know, we're all seeing the provincial numbers of cases rising daily. Grey Bruce does continue to see cases, and currently there are 31 active cases. We must recognize that there continues to be community spread, and we must remain vigilant in our strategies to prevent infection. I'm just going to run through them, do this every time. We are continuing to actively screen every person who comes in and out of the home. Active screening includes documenting their name, contact information, taking temperatures, asking the very specific screening questions, reviewing PPE and hand hygiene. Staff are only working in 1 facility. Staff interval testing continues every 2 weeks, and it's mandatory. Minimizing the movement of staff from home area to home area. All staff and visitors in the home are wearing surgical masks at all times. All new residents moving into the home are tested for COVID-19 and are isolated for 14 days, and also at the end of their 14 days. As we've seen in Lee Manor, plans are in place to very quickly put outbreak protocols into action. We are continuing to monitor our PPE supply, and we did just put in another bulk order of surgical masks just to be prepared. So updated Directive Number 3. It was released on the 7th and came into effect on December 9th. It was updated to align with the provincial framework, and we talked about that on the 24th. So this directive really just supports that ministry guidance document that we talked about on the 24th, talking about the yellow, orange, red, and gray zones. It provides information and clarification around admissions. So there is some information about admission of residents to long-term care from hospital in green to green zones, no longer requiring a 14-day isolation. However, none of us are in green zones. we're in yellow and everyone around us is in orange or red or gray. So that really doesn't apply to us at this time. Absences, it clarifies that absences are not permitted in orange, red, or gray zones. We are in yellow, but we are continuing to suspend outings and day trips. The exceptions for this are medical and compassionate reasons. So if you have such a situation, you need to contact the home and talk to the team about what the options are for a special circumstance for an outing. It clarifies the management of visitors. So it clarifies that long-term care homes must comply with the minister's directive for mandatory testing, and that essential visitors, which includes our designated care partners, are allowed to continue visiting in orange, red, and gray, and when the home is in outbreak. It also suggests the masking of residents in common areas. And this would be for residents who can tolerate wearing a mask. And we have begun discussions with our residents about what that looks like and being able to offer masks to residents if they wish to wear them in the common spaces. I do just want to reiterate that we do continue to have the distancing. So if there's a small group activity, people are distanced, and those strategies are still in place. The directive reinforces that long-term care homes must comply with the mandatory testing for all staff, students, and essential caregivers. And then today, the Ministry of Long-Term Care released a frequently asked question document specifically around visitors. And I'm going to share the screen because it came with a chart. And this question came up on our last call, and it was a little bit, it is a little bit confusing to get our brains wrapped around the frequency of testing. So I'm going to share screen. Okay. Rob, can you confirm that you can see the
Yes, I can.
memo? Okay, great. So those of you that are on the phone, I apologize. I'll just go through this quickly. This reiterates what I just went over, that the policy must align, our policy must align with the framework. So the yellow, orange, red, gray. It defines essential visitors, and we'll circulate this with the follow-up email that goes out tomorrow. But the chart is what I really wanted to share. So ensure this reviews testing. So ensure that staff, students, and volunteers are tested according to the table below, and then the same with caregivers, which includes our designated care partners. So here's the chart. So the language is that staff, students, and volunteers are to be tested every 2 weeks, which we're in yellow, or every week if you're in orange, red, or gray. Caregivers, though, it says provide proof of a negative COVID test in the past 2 weeks, and then verbally attest that you haven't subsequently tested positive since then. And then in the orange, red, or gray, it moves to every 7 days in the past week, the same expectation. General visits, so indoor and outdoor visits are still permitted in green and yellow, but moving into orange, red, and gray, those visits are no longer permitted. So I wanted to share that, and I will circulate that information around. But I just wanted to talk a little bit more about the testing. So we have all 3 homes are approaching the testing very similarly, but with some differences. And so everyone should be on a every 14-day cycle of testing. And some people are finding that, I've just spoken to a family that's working their way through this, and they found that if they tested every 14 days, there was at times a lag between the results. So they might have missed a day while they waited for their result to show up on their screen so that they could prove the negative result. So they found that if they tested every 10 days, they didn't ever have that iffy chance of missing a visit. So there are ways to look at that. We are offering the testing on site. There is assessment centers available as well, and we always include that information in our newsletters for you as a resource. And in the new year, we're looking at streamlining the testing and offering the ability to book online, and that would allow you to map out your testing from what your experience has been. So some people go every 14 days and they always have their result in time, and it isn't a challenge, and other people have faced challenges. So we may have more questions and discussion about that after, but that's the information that was just clarified for us today. Last evening, the ministry also sent out a memo to long-term care operators, reminding us of our responsibilities to our residents and highlighting the importance of having a staffing plan in place over the holiday. And they really were very specific about ensuring that staffing levels are, that there's plans for staffing over the Christmas holidays, and that there are contingency and backup plans. And so this was a good opportunity to talk to all of you about what that means. And there's been lots of questions about the fact that there's different zones around us. We're yellow, but others are orange and red. So the provision of care and service in each of our homes is a finely tuned machine that is made up of integral players that support all the departments. We have team members and designated care partners who live in yellow zones, in orange zones, and in red zones. At times, we rely on our partners at Plan A, which is a staffing agency that we have a contract with, and they're dedicated to providing staffing support for long-term care. And at times, we rely on those partners to support the care and service in the homes. We work hard to share information and provide education and put these measures into place so that all in an effort to keep everyone safe. So really our measures that we have in COVID, what we have is our public health and infection control measures and trust. We are screening at the door, our taking of temperatures, our testing, our wearing appropriately of PPE, our practicing PPE, our keeping our distance, being mindful of our activities outside of work. Those are all the strategies that we have to manage and mitigate the risk of COVID-19. So there is lots of confusion and worry about what about red, what about gray, what about that? And it really isn't about who comes from where and when. Preventing or managing COVID isn't about that. It's about having our strategies in place and following the protocols and doing our very best every day, every interaction, every moment. I wanted to give an update about the Designated Care Partner Program. It's going strong. There are currently 258 DCPs safely supporting residents in our homes, and that's really, really exciting. We will continue to offer the variety of visiting options to best meet the needs of our residents and our families. And so those do continue to be our Color It Connect virtual visits, window, outdoor visits, I think are now over with the weather. If we're not in outbreak, indoor visits. And then of course we have essential visits, which are those more urgent, end of life, critically ill circumstances, and then the Designated Care Partner Program, which is bedside and ongoing. The homes have been very innovative with their outdoor visiting, their window visiting solutions. And so check those out. I'm really impressed. And I'm trying to get my head around the phone on one side, phone on the other, but we do what we have to do in these strange, strange times. Resident and family satisfaction surveys, it's that time of year again. And so the satisfaction surveys are coming out. Watch for the family survey at the end of December, and we really want to hear from you. Your feedback is key to our quality improvement planning. Vaccine, I have been following along the news, just like all of you. It is very exciting that the vaccine has come to Ontario. We're keeping our eye on opportunities, and we will do what we can to ensure our residents and staff have every opportunity to get the vaccine as soon as we can. I don't want to be a bit of a downer here, but I also have been reading from some leading physicians in infection control and pandemics, and they say we're at about halftime. So maybe Christmas can be our J-Lo concert, and we do that safely, and we celebrate halftime. At least we see there's hope on the horizon, and we still need to dig in and know that we still have a bit of ways to go with following these protocols. The newsletter was full of Christmas spirit. If you haven't seen it, have a look. The teams have amazing and innovative plans in place for the holiday, and they're in full swing. The homes have been decorated, and plans are underway for the dinners. And we talked a lot about the different opportunities that are happening to celebrate Christmas in a different way. And it will always be the COVID Christmas. And so watch your social media accounts as well for updates on all the exciting things that are happening in the home. There's a really great Color It story on the Grey County Facebook page from Rockwood, and I really think you should check it out. So that's the update, Rob. Lots of information, and maybe some questions.
Yeah, it looks like we have a couple coming through here. So if you have any questions, please do enter them in the Q&A section on your Zoom client, and we will get to those one at a time. So our first question is, why is a person from a red zone allowed to take a resident out for a medical appointment?
Why would they be allowed to take a resident out for an appointment? That's a good question. I really, again, I want to go back to what's really important is the strategies that we have in place for each interaction. And so we call them strategies, and these measures, the screening, wearing PPE, that type of stuff. And what it really is a risk assessment. So the teams are trained to do a risk assessment. That's what nurses do all the time. And so they do a risk assessment. What we don't know about, just from the outside looking in, is what's happening in that person's life that lives in a red zone. So we have DCPs who I've talked to who live in a gray zone, but they are much less at risk of COVID than I am in a yellow zone going to the grocery store. They order their food in, they live alone, they follow various protocols. And so where someone lives really isn't indicative of their level of risk. It's the places they go and the things they do that increases all of our risk.
All right, thanks for that, Jen. Are window visits canceled at Lee Manor at the moment?
No. Oh, that's a good question. I'm gonna wait for someone to, I was gonna get all excited about window. So the window visits at Lee Manor, I feel like they are suspended right now during the outbreak. Window visits are canceled, thank you, during the outbreak. But wait, because when the outbreak is over, it's a new site, and it has a bit of shelter, and the resident has a bit of privacy, more than the previous windows, and so it'll be worth the wait.
All right, so that does touch on another one here. So we're expecting that will resume when the outbreak is declared over, and if everything goes as we hope, that could be as early as the 21st.
That's correct.
Perfect. Lee Manor is telling visitors that they can go by the test result date, not the test date, i.e. 2 weeks from when you get the test back, which does conflict with what was said tonight. But you said that we did get some clarity today. And has that been communicated to our team?
Yes, and we are still trying to sort it out. It's the thing about the tests is that, and I had an opportunity to talk to some public health folks, and they helped me better understand for testing to be on its own a source of comfort on its own. We would need to be testing, and confidence, let's say, we would need to be testing every 3 days. That's the only sure way. Testing every 3 days, and people are isolating and not leaving their homes in between testing. So testing every 7 days or every 14 days is just another layer of a protection measure, just like wearing the mask, doing good PPE, keeping our distance. So it's all of those things layered together. So when we get into the nitty-gritty of, is it the test day or is it 2 days later on the result day, it does get confusing. What the ministry document says today, actually I'm going to just make sure. It says proof of a negative COVID test result. So even that's clear as mud. Is it the day that you were tested? Both dates show up. Theoretically, if all things go well with lab processing, there shouldn't be a lag time. I also ran the language by some legal support, and we believe the spirit of the language, the intention of the language, is to be tested every 14 days, to be on an every 14-day testing cycle. It becomes much more difficult if it's about the day the result comes. So we are still sorting it out to be certain, but we feel confident that with all of the other strategies in place, if someone's on an every 14-day cycle, they should be able to show proof of their most recent test, and it's within the 14 days.
Okay, thanks, Jen. On the subject of testing, I do see a question in the chat. Do assessment centers allow family members to test? I thought they might only allow people with symptoms.
As far as I know, they are still booking appointments for essential caregivers, designated care partners. And I think in our local assessment centers, they're not turning away asymptomatic people looking for tests. I will do some follow-up to find out that for sure. I do think that there are zones that are gray where they have had to be more restrictive about testing because the capacity has just become strained. But the last update I heard locally was people were still able to book tests at the assessment centers. And they recognize, we've had conversations locally with our partners about the importance of caregivers needing access to testing.
Okay, thank you. Are there any changes regarding gifts to residents, such as plants or flowers?
No, I believe the processes that have been in place with gifts are the same. So I'm gonna watch my phone again to see if somebody sends me something about plants, because I wanna make sure that I have the accurate information about plants. I feel like we are holding them 24 hours, but I wanna just make sure. Something came up about if you're buying clothes or gifts of clothes for Christmas, check with your home about the instructions around labels, because we don't want to get somebody opening a gift and then we go label their clothes and it turns out it needed to be returned. So there are some instructions around gifts of clothes. So what I'm getting from all of my people, thank you so much, holding plants for 24 hours and gifts for 24 hours. And just a reminder that there's some sensitivities about really scented plants. So we're a lesser scent is better.
Okay, thank you. Rachel is asking, can DCPs be notified when there are staffing shortages in a wing so that they can assist instead of bringing in Plan A worker?
I love the offer. There is legislation that requires us to have a level of staff, a staffing plan that supports the day-to-day needs of the residents. And so we would be happy to talk to you about supporting your resident and what you might be able to do to support your person. But we are obligated under the Act to have staffing levels at the level of our staffing plan.
So if a DCP, can we take in a gift, or does it still have to be held for 24 hours?
I think it still has to be held.
When it is able to go in. It will be held for 24?
I think so. Yes. We should do, okay, in the new year, we're doing a panel. So all these amazing people that are doing this work in the homes, supporting the residents and supporting me, we're going to do a panel and it'll be great. Now they might not answer the next time.
I was just going to say, I think 4 people just dropped off the call here. Will an email go out to everyone once all test results are known, even if it's before the 2 weeks are up?
Yes, we'll give an update. We can commit to giving that update. That's a good news update that we should send out.
Absolutely. Who would I contact about clothing gifts at Lee Manor?
I think that you would start with Elena.
Elena,
okay. And she said, yes, they can call Elena.
So Elena will be on our panel.
Yes. Oh, now they really won't answer.
When and if a COVID vaccine is available, will I get it at Rockwood Terrace or my doctor's office? I'm 70, a DCP, and one or the other just need to be informed.
I have no idea, but I love outside the box ideas. So if there's an opportunity for us to support the rollout of it, we'll figure out what that looks like.
Just a comment, screeners need to check COVID result dates. I overheard someone laughing they had an old result and never got tested and still got in to visit. I realize it's a trust issue, but sadly it's reality that some will not follow and respect the rules.
Yeah, thanks for that. Good reminder.
Is Lee Manor's outbreak floor allowing family members to take residents' laundry home to do it there?
Oh, yikes. We're gonna wait for that one. And I don't know the answer to that question.
Let's leave that. Staff continues to be amazing. They're definitely looking tired, but they hide that weariness behind by caring so lovingly for residents. They're soldiers on the front line in this battle. Kudos to them and to the management team for steering us through this challenging time. Thank you very much for that positive comment. We will have to make sure that gets passed along to everyone.
We're going to follow up on the laundry question. So if you want to email either, if it's easiest, email Rob at the email that goes with this account, or email Elena or I, and we will follow up on the laundry.
So we have 2 questions related to food here. One is asking, can we bring lunches in? So that would be from a DCP, I'm guessing, maybe a visitor. And are baked goods okay to put in Christmas gifts for a resident?
So I think you can bring in baked goods for the resident. We still have the no eating together rule. So the challenge with universal masking is that you can't eat with a mask on. So the DCPs can bring in their lunch, and there is a designated space for them to eat. And you need to check with your home as to what that looks like. If you bring in something for the resident, you can bring it for the resident, but you can't eat it together. And I just got a reminder that Lee Manor first floor is now peanut free. So just a reminder.
Okay. And there was some clarity provided that it was lunch, like a takeout lunch brought in from Dairy Queen.
Yeah, so they could bring that in for a resident or for themselves. They just need to be separate eating it.
Okay. When will we get the results from 2 North COVID tests? So if you just want to...
Soon, we hope.
Yes, we have most of them back now, and then just the 4 outstanding at this point.
That's right. And just out of an abundance of caution, we swabbed those 4 people. We tested those 4 again and sent a second set. So we might actually get 8 results for the same 4. But with the way the volumes are, when getting that many tests back, but not just a small amount, we wanted to just be, we just wanted to be extra careful.
I think sorry, Lori, I think we did ask your question. If a DCP, can we take in a gift or does it still have to be held? And it does have to be held, is what I heard from Jen. And who will open the gift when it is able to go in? Would it be given to the resident to open? I guess that's maybe the part we missed in there.
Oh, that's a good question. So I think if there's special instructions, like the DCP is going to be in, just put a note on it. Otherwise, I know from over the years being at long-term care homes on Christmas Day, it's a very joyful and fun morning where the residents and the staff help residents open their gifts, and often Santa visits, and there may be I don't know, maybe there's a plan for Santa who's been COVID tested and coming in. I feel like Santa is dropping by at least one of the homes, and the program staff and the PSWs help to deliver and open the gifts. And Santa works at Rockwood, so you know, in his off time. So Santa's going to be at Rockwood on Christmas morning. And also at Grey Gables. He's going everywhere. I'm sure he's at Lee Manor too.
Perfect. Yeah, sorry, Lori, if there was another question, I'm not seeing it here. So if you re-enter it, we will get to that. There's a question here that I understand the COVID staff member came from a red zone. Are staff tested and proven to be negative before they're allowed to work? So I'll let you handle that one, Jennifer, but I will just let everyone know, I'm not sure if you follow outside of our area, but there are a number of zones around Grey County that have moved into the red this week. I believe Simcoe, Muskoka is there, Dufferin, Wellington, so a lot of our close neighbors. So I think that is a very relevant question. Yeah, and so yes, if staff are being tested every 2 weeks, and if they are away for a period of time greater than 2 weeks, they are tested and have a negative result before they return. Thank you. Also, does a window visitor have to get a COVID test after the outbreak?
No.
No? Okay.
No.
Perfect.
They just put on their woolies, and but there is a bit of shelter, and I think that there's also been some heat sources put together at some of the sites, and so you put on your hat and your mitts, and it's great because then you can also take people with you just from your own bubble. Okay, so we're just asking for Alina's email. I can look that up here. Kathy's asking, can a DCP bring in a smoothie or other beverage for a resident? No 24-hour wait. Yes.
So that would be, yep, similar to the other food. So agency staff, do they have to be tested negative before they come into work at Grey County? Are they part of that 14-day cycle?
Yes, they are. And they're dedicated. When we work with agency staff, they're dedicated to our site. They're not jumping around. They also must follow the single location requirement.
Okay. So Rose is asking, she's dropping off a gift from Santa for her sister. Can it be delivered on Christmas Day? Is that something we could get arranged at the home?
Yep.
And who would she contact?
Contact the program department.
The program department?
Yeah. I just got a note just to highlight for Lee Manor during the outbreak. If you're a DCP and you're coming in to visit your person, we're discouraging bringing in things like smoothies and coffees and tea just during the outbreak. And then once the outbreak is over, then that restriction will lift.
Perfect. If you have more questions, we do have more time. I'm not seeing any more coming in here.
I want you to know I put my tree up for you, and it's all for all of you. My mother-in-law watched the video and she said that I looked like I was in a cave and I needed some color behind me. So all of the ornaments on it are made by my children or handmade and gifts. And yeah, it adds a little bit of festiveness to my space.
Very good. Since we have the time, do you want to tell a little bit more about that good news story that you alluded to at the start?
Sure, and this is where we need the panel because it's not my story to tell, but I'm honored to be telling it. So at Rockwood Terrace, there is a resident, Muriel H, and there she is. And at a care conference, she mentioned that one of the last items on her bucket list is to learn how to ballroom dance. And of course, the innovative and detail-oriented program staff knew that one of the other residents on that same home area, their DCP is a ballroom dance instructor. And so the magic happened. They came together and figured out how to do a COVID safe ballroom dancing lesson. And some of her family members are outside. And if you can't tell, they're holding up tens, like in Dancing with the Stars. And so even in a pandemic, the teams are finding ways to make Color It Dreams come true. And it's so awesome.
I love it. That's so great. Is there a way to give gifts to staff at Christmas?
There is, and we are always very appreciative. You don't have to, but as a family member to a resident living in a home, I get it. It's nice to be able to do that. So you can drop off gifts. We are really requesting that if it's chocolates or that type of something to share, that it be something that can be individually wrapped. So we're trying to get away from the community chocolate box. And that reminds me to remind all of you that we're doing a lot of discussions in the homes about the spaces where we let our guard down. And that spaces like the lunchroom, the change room, and we need to be really extra vigilant there. And it's the same in our small groups. When we do get together, we really need to be careful about who we're with and how close we are. And that's where the trends are happening with COVID cases. It's linked with places that we're more comfortable. So we're trying to get away from the community chocolate box, and we are very appreciative of your acknowledgements for the team's work.
A question here. Can both DCPs visit a resident at the same time?
Yes, unless the home is an outbreak. So at Lee Manor, DCPs are able to visit only one at a time, but at the other two locations, they can visit two at a time.
Thank you. Are we allowed to bring iPads into the home to share pictures with our loved ones and or to do FaceTime with other family members?
Yeah, that's great.
And is public Wi-Fi available for DCPs in the home to jump on and do that, Jen? Do you know?
I think so. Yeah, lots of yeses. So connect with your program team, and they will be able to literally connect you to the public Wi-Fi.
Perfect. So if that COVID staff member was tested and proven negative, how was it that they then showed positive?
Right. So remember, the tests are happening every 14 days. So COVID is one of those things that we can't see it, and we can only do our best to be careful. And so somewhere along the line, that person was in contact and did get COVID. And so I had my COVID test today. That result will come back negative, hopefully. But I could go and be in contact tomorrow with COVID and have symptoms in 3 days And so I just got my negative result, but then I become symptomatic, I go get tested again, and that result could be positive. And that's why testing is just another tool in our toolbox. It isn't the only tool.
Mm-hmm. Yeah, that really does reinforce that it is a snapshot in time, and that's what we're able to do right now. And it is just another risk mitigation tool that we do have. Yeah. So I have entered Alina's email address there in the chat, everyone. Sorry that took a moment to look up.
And I can include the email addresses in the follow-up newsletter as well.
Great. I think that would be appreciated. A huge thank you to everyone for all you do at the homes. Merry Christmas. Thank you very much for that. I'm so impressed by you guys. My parents are at Grey Gables, and I'm so happy with the care and responsiveness. Thank you.
I do want you to know that all of you, that I really appreciate the time you take to participate in these calls. The questions that you ask really help us to make sure, are we meeting your needs? Are we meeting the residents' needs? Are we on the right track? Is there something we need to look at, do differently? So I really appreciate how engaged you are. You read the newsletters, you follow the rules and the instructions and the fact that they change just like that. And so I really appreciate it. One of the team members said to me today, it takes a village, and it really does. And we're so lucky that the Grey County long-term care community isn't just the bricks and mortar. It's so much more than that. And we really appreciate all that you have done to contribute to getting us through this, where we are, to halftime. So here we are at halftime.
All right, Jennifer, I think that is pretty much the end of things here. Did you have anything you would like to end on tonight? I'm not seeing anything coming
happy
in.
holidays, and thank you. And wash your hands.
Yes, thank you, everyone. I hope you all have a safe holiday season. It's going to be different this year, but we will get through it. Take care, everyone.
Great, thanks.